fact, multimodal care plans can be developed by a singular provider if they can understand all the different pieces that go into it. I think it's ideal to be able to collaborate like we do in our work together, but even a single provider can learn about all the different components that are important to assess and then make a treatment plan. For example, one of the things that I think is really important is understanding the psychosocial parts of pain management and of someone's pain experience. So assessing, their experience at home, their relationships, how it's impacting their mood, impacting their life in a number of different ways. And so all providers, whether you're a physical therapist or whether you're a physician or a nurse practitioner, pharmacist, can be assessing those things and kind of providing a fuller picture of what's going on with patients.
Absolutely, and we all can be working comfortably within our scope while providing some aspects of different portions of a care plan that another clinician may provide if that person were available to be part of the treatment team. So cognitive behavioral therapy is one example, and as a physical therapist, I can incorporate those components into my treatment plan very easily and stay within the boundaries of my license. And I can support a treatment plan that I know might be happening with another discipline, like a colleague in psychology or mental health or behavioral approaches to pain management, or pharmacy. Even though I'm not a prescriber, I can incorporate some principles and concepts into the work that I do with patients, helping support what they are doing with the pharmacist or their treatment team, primary care doctor or pain medicine doctor who may be prescribing medications for pain. So I fully agree that multimodal care means having multiple elements that consider all aspects of the biopsychosocial framework for a person. But even though it's ideal to have multiple team members working together with that patient, it's often not possible or accessible. So we like to think about what would we do if we didn't have each other.
We're so lucky to be able to have a team and the resources to have a team where we work. But again, not everybody has that. And even when you do have a team that's kind of already created that you work within, that doesn't necessarily mean that every patient is going to be cared for by that whole team. And so oftentimes, it's as simple and as complicated as making phone calls to other providers, getting releases of information to speak to mental health providers, behavioral health providers, physical therapists, and getting a good idea of what the comprehensive plan is, and then each of those team members reinforcing what the other team members are doing. And you don't necessarily, again, have to work in the same office. You want to try to network within, the folks that who might be like-minded, or you can maybe kind of help them be a bit more like-minded over time, so that you create that kind of team around each case. And it takes a little bit of work, but I think that over time, I think it really pays off in patients having better outcomes.
Yeah, those are all great points. I would add that to have a cohesive team, even if you're not geographically co-located, at the very least, each team member should understand the fundamentals of what the other team members are going to do and say with the patient, so that those messages can be reinforced, so that we can all be working towards similar goals and be in communication about all of the elements of the care plan, even if we don't ever sit in the same room with each other. So open communication and having a mutual understanding as well as mutual respect for what the other care providers are doing with that patient are key elements.
Yeah, that's actually pretty difficult, getting everybody's schedules lined up and getting in communication with everybody. But yeah, I think whether it's phone calls, emails, whether it's making sure you have lunch together and have a chance to discuss patients, I think that's really important. I think good old-fashioned making a phone call, sending an email, those kinds of things can mean a lot. Yeah.
We have a mix of access to different clinicians working with patients that we mutually see. And in some cases, ideally, we sit down together on a daily basis talking about those patients and their care, or a weekly basis minimum if we have that luxury. But we also work in a situation where we care for people who come from a great distance away. And so their primary care team may be 500 miles round trip, and we're not going to see those people. So they also are very busy clinicians, and getting them on the phone may not happen regularly. What we can do instead is send regular reports about how that person is doing under our care, have them read electronic records. We have means of electronically tagging other care providers so that they get alerted to notes that we write that we'd like them to see. Or we may verbally communicate to the patient a message that we'd like that person to take back to their care team after they've worked with us or while they're working with us. There are a number of ways to do it. And I think one last thing to add is it's equally important to keep people updated on progress and barriers and share as much good news as you can about how people are doing. And that's something that Dr. Palio does quite well. She sends updates. We create report cards on how patients are doing in the context of a rehab program we run together. She sends report cards to the care providers who are working remotely just to say, hey, this person is doing really well, and here's how we know that. So here's some raw data for you to have too and examine and go over with the patient later. They always appreciate that.
I thought it was a really good point you said earlier about really kind of operating at the top of your scope and your practice. And I think that whether you're a psychologist like me, and we don't prescribe obviously, but we need to know about pain medications. We need to know about what people are doing in physical therapy. We have to be able to look for concerns that patients are having around those other treatments and be able to communicate with those providers as well as progress and be on message, using the same language, using the same reinforcement, having a really clear and direct care plan that is related to functional goals, I think is really important, that everybody knows what direction we're working toward with the patient and what the patient really wants out of care.
That's a great point. Being on message is so important. It won't work very well for a patient if one person tells him, it's fine to go jogging, that's a great thing for you to do, and another person the next day says, it's dangerous for you to jog, stop doing it. That's very confusing and leaves a person in pain and in great conflict about how to move forward. So the way we've handled situations like that when it comes up is we have an open dialogue, reach out to those providers, give them evidence that we have access to that they may not have a chance to get to because they're so busy, and have some sort of open door on a discussion about why we make a recommendation, and maybe they'd like to know more about why we did that so that they can reinforce what we do. And it's worked quite well, actually. If you have some good communication skills, people are open to learning.